Okay, hi everyone. I think we'll go ahead and start. Thank you so much for everyone who's joined us so far. Good morning, good afternoon, or good evening, depending on where you are. And thanks for taking part in this Policy Dialogues seminar. Policy Dialogues is the name of the series of transdisciplinary seminars from the Johns Hopkins University Universitat Pompeu Fabra Public Policy Centre. And they aim to make knowledge around policymaking and its impacts on people's quality of life, well-being and equity more accessible. So I'm happy to share that today we're celebrating the 23rd Policy Dialogue session. And if you're interested in previous topics that have been covered, you can see the full videos of all of our previous sessions on the Centre's YouTube channel, which I'll share in the chat in a minute. So today we've got the privilege of inviting Dr. Craig Pollack from the Johns Hopkins University to share his research on policy making for housing, equity and health. Dr. Pollack is the Katie Ayres Endowed Professor in the Department of Health Policy and Management in the Johns Hopkins Bloomberg School of Public Health and the School of Nursing. He's an internal medicine physician and he conducts research at the intersection of housing and health to help inform policies that help individuals and families live in safe and affordable homes. So before we move on with Craig's presentation, I'll also introduce the discussant for today's session, which is Josep Maria Caroz. Josep Maria is a pre-doctoral researcher at the Universitat Pompeu Fabra. His research focuses on housing precariousness, equity and health, with an emphasis on housing policy in Catalonia. So thank you so much to both Craig and Josep Maria for sharing your knowledge and your experience with us today. I'm really excited for this session. I think it's going to be extremely interesting and informative. So just before we go ahead, just to let you know, there's a chat to all participants. You should be able to write questions in the chat throughout the presentation. So, and we'll go ahead and read those out after the presentations have been finished. Okay, thank you so much, and over to Craig.
Great. Well, thank you so much for inviting me to participate in today's session. I'm really excited for the discussion and hope there's a lot of great questions. So let me go ahead and share my slides. So hopefully this is working for everyone. So I'm going to be talking about kind of what we know about building health through housing policy, and focusing really on the US context, and excited for the conversation on kind of the international comparisons and understanding what's happening in the US versus kind of other places and some of the policy solutions. So in the United States, we are in the midst of a housing affordability crisis. So there's a lot of different ways, a lot of different numbers that I could throw at you to try to make the case that there is not enough affordable housing to meet the needs. This is a report that's put out every year by the National Low Income Housing Coalition, which is an advocacy group based in Washington. And what they do is they calculate what would somebody earning minimum wage, or what would somebody need to earn working 52 weeks a year, 40 hours a week, in order to afford the average two-bedroom apartment in each state. And you can see that across the United States, that this wage that an individual needs to earn is quite high and much higher than the minimum wage. So in Maryland, where Johns Hopkins is based, an individual would need to earn $36.70 an hour. Unfortunately, the minimum wage in Maryland is only $15 an hour. And the result of this is extreme levels of housing insecurity and housing precarity for families and individuals across the United States. So 1 in 2 renters lives in what's considered unaffordable housing. Often we define that as by paying more than 30% of one's income on rent and utilities. 1 in 4 renters pays more than half of their income on rent and utilities. 1 in 14 receives an eviction filing every year. 1 in 28 renters is actually evicted, and about 1 in 500 people is homeless without a home. So these are enormous problems, and they've only been growing in the United States over the past many years. And the framework that I want to use to kind of structure my brief time with you today is this very simple framework by Lauren Taylor that came out in Health Affairs several years ago. And she posits, and other researchers have also kind of used a similar framework to say that there's kind of four main ways that housing impacts healthcare outcomes and healthcare costs. And these ways are through housing stability, people needing to move a lot, through quality and safety of the housing, through its affordability, and through the neighborhood context. I'm going to walk through each of these and talk a little bit about some of the work we've done trying to think about policy solutions designed to support renters in particular who are facing issues in each of these domains. I like this framework because it is really simple. It kind of presents these four different characteristics of the housing, but it's also important at the outset to say that these are really interconnected, right? That people make trade-offs about where to live among all of these different dimensions, and and also saying that people make trade-offs about choosing where to live, recognizing that these choices are, of course, structured by a range of different policies. And in the United States context, it's incredibly important to recognize the nefarious role that race and ethnicity has played in a lot of the kind of housing, the ways that housing choices are structured, and ongoing history and legacy of discrimination in the housing market that is incredibly important to state and recognize at the outset. So in our time, I'm going to walk through each of these in turn, and I'm going to start with stability. So as I mentioned, eviction filings are incredibly common. So in 2018, last year where I was able to find national data, there were about 3.6 million evictions. And we also know from a health perspective that evictions are associated with a wide range of poor outcomes. There's a growing body of research in this ever since Matt Desmond's book Evicted, which has found that evictions are associated with lower rates of food security, so greater food insecurity, lower cognitive scores around for the children, disrupted access to safety nets, and even increased risk of adverse birth outcomes. And conversely, adverse birth outcomes are associated with increased risk of eviction. And so what we're seeing here is really reciprocal process where housing insecurity through the form of evictions, through unstable housing, needing to move, leads to poor health outcomes, but also in turn that poor health outcomes can increase the risk of housing stability. And this kind of reciprocal process we see with a lot of the ways that we think about housing and its link to health. The thing that I want to center on is this idea of right to counsel. And what happens when a family in the United States receives an eviction notice saying that their landlord would like them to move out of their property, that often in many jurisdictions across the United States, they need to go to court in order to enact that. And what happens when individuals go to court is that landlords overwhelmingly have legal representation, whereas a very, very small percentage of tenants who are facing this are able to have legal representation, are able to afford it. And there's been an increasing move to have what's called right to counsel. And in criminal cases in the United States, if you can't afford having a lawyer, one will be assigned to you by the court. And so this is kind of parallel to that in the setting of housing court, to say that if you are facing eviction, that you should be able to have access to a lawyer. And New York City, this is a map of, was the first jurisdiction to launch right to counsel in the United States, starting in 2017. And what the map shows across the different boroughs of New York City is that the implementation date of this was really staggered. They focused on certain high-risk neighborhoods and then rolled it out over time as they were able to gain expertise, gain more funding for this program. And a lot of what our group and my colleagues have been working to do is try to use these different types of natural experiments of policy exposures to understand what are the spillover effects of housing and housing policies designed to improve stability and security on health. And so this is work led by Kate Leifheit, who's a professor at UCLA. And what she did was she took that natural experiment in a difference in different model to understand what was the impact of right to counsel on birth outcomes. And amazingly, she found that right to counsel was associated with a 0.96 percentage point reduction in adverse birth outcomes among infants born to Medicaid-insured New Yorkers. Medicaid is the insurance program for low-income individuals in the United States. And kind of calculating that out, that equates to about 600 fewer infants born either preterm or with low birth weight each year in New York City. And that preterm and low birth weight birth has implications not only for infant health, but also kind of throughout the life course. And one thing that Kate kind of often reminds us is, and I'm going to go back for a slide, when you're looking at a policy exposure, you're looking at a policy exposure across a census tract, in this case, across a small administrative area. And that's not looking at the people that actually had right to counsel, those people that were evicted. So you would think that the impact, if you were able to focus your study on just those individuals, would even be higher, because it's kind of diluted across the area, but also suggesting that there might be, significant population level benefits. So I'm going to now turn from talking about stability to really talk just this one slide about housing quality. And I'm not going to spend a lot of time on this, because this is something that I think has been in the kind of the wheelhouse of public health for quite some time. This is a quote from Florence Nightingale, a famous nurse in the United States, that said, "The connection between health and the dwelling of the population is one of the most important that exists." These are pictures from tenements at the turn of the 19th to 20th centuries in the United States, showing the cramped, crowded conditions that really led to this rise in public health. And I think that we're not seeing some of these same conditions as frequently today in terms of lack of indoor plumbing or this degree of crowding, but I think a lot of the questions about quality continue to come about. I think most specifically around lead and radon exposure as two known toxic exposures in the home that we think about, but there's, I think, many other that we can think about. So that's the only slide on quality. Happy to talk more about that in the Q&A, but I want to turn to talk about affordability. And I like this figure, which comes from Harvard study on Center for one of their centers, which shows kind of what happens as families are cost burdened to their spending in other domains. And so unburdened families are spending less than 30% of their income on rent and utilities. Moderately burdened are those spending more than 30%, and severely burdened are those spending more than 50%. And this, I think, visually makes the case that as people spend more on housing, they spend less on food, they spend less on their transportation, they spend less on their retirement savings, and they spend less on their healthcare. And I want to make the case that I think all of us on this call probably recognize that it's not that people who spend more on their housing are automatically less hungry, or they automatically have less need for healthcare. It's instead that after the rent eats, there's less left over for them to kind of fill their own stomachs, to meet their own basic needs. And I think this is really critical. And so now I want to turn and talk about a federal program in the United States that's designed to try to improve housing affordability. And in particular, I'm going to talk about federal housing assistance. And what federal housing assistance does is it limits the amount that households are able to spend on rent and utilities to about 30% of their income. This is kind of a federal program that's administered through these public housing authorities across jurisdictions in the United States. And there's kind of three main flavors of these. The first are what are considered public housing. In public housing, the housing authorities own the buildings. These were kind of first developed, and they can be large in scale. And there's been a move away from public housing because many of these were kind of not properly funded, and many fell into disrepair in ways that the housing authorities and the federal government has sought to recapitalize in ways that I'm glad to talk about. The second, which is the largest program, is around housing choice vouchers. Housing vouchers are people get almost like a ticket that they're able to use their housing voucher to lease an appropriate home that meets different quality standards and affordability standards on the private market. They go to a landlord who works to accept those vouchers or not. The third is a multifamily housing, which is kind of another program that limits spending. Overall, and taken together, these programs serve about 10 million individuals. But it's also really important to remember that this is not considered an entitlement program in the United States. And what I mean by that is if you're eligible for housing assistance based on your income and family structure, it doesn't mean that you automatically get it. Instead, only about 1 in 4 people who are eligible for this receive it. What that means in Baltimore when the Section 8 waitlist, Section 8 is another name for housing choice vouchers, opened up for the first time in a decade, they opened these up for a very brief period of time. And the idea is that, tens of thousands of people sign up to try to get this housing voucher, to get in public housing or get one of these units. And then they close the wait list because they say, you know what, we know we're not going to be able to make it through all of the people that need it. And so we don't want to give people the false hope of continuing to sign up. It's not that a lot of the housing authorities don't think that's a good idea. So instead, they open it up, thousands and thousands of people apply for it, and over time, people get selected from a wait list in ways that there's just so much crushing need for this type of federal assistance. I want to talk about one of the studies that I've been leading along with my colleague Robin Yabroff, an amazing study team that's funded by the National Cancer Institute, that we call the HOME study, which is the Housing Assistance Outcomes, Medicare, and SEER. Let me explain what some of those words are for an international audience. So what this study is trying to do is trying to create a data resource and try to understand what is the impact of this type of federal housing assistance on cancer outcomes using really large administrative data. And so the first step in that was to take this federal data on who receives different types of housing assistance, and then link that with 2 other data sources. The first is SEER, which is a cancer registry data. So really great information on when somebody's diagnosed with cancer, the date of their diagnosis, the type of cancer, the stage of their cancer, and the like. And then the second thing that we linked it with was Medicare claims. So adults over 65 are eligible to receive Medicare. And so it's administrative data on kind of their healthcare use over time. That took quite a long time to create that data set. You can imagine working through the different legal requirements and then the practical aspects of that. And excitedly, we've started to use this data set to look at what happens, comparing people with housing assistance to otherwise similar people that don't have housing assistance. And this is a preliminary data from our first study. And what this does is it's comparing people in the darker gray that don't have housing assistance, HUD is the name for the agency that administers housing assistance, versus the lighter gray for people that have housing assistance. Sorry, some of the asterisks are a little bit off here, but I think the important takeaway message for this is that there are some, and these are predicted probabilities, so kind of putting everything into a model. How do we think about who's going to be diagnosed with regional or distant disease, with the idea that people who are diagnosed with regional or distant stage cancer have a harder time with treatment, are more likely to have high healthcare costs, more likely to suffer morbidity and mortality from it. And we can see here that there are some small but meaningful at a population level differences in the rates of regional and distant disease, especially when we look at breast cancer. People with housing assistance, with HUD assistance, are more likely to be diagnosed with this in situ or kind of localized disease, or very early disease, and less likely to be diagnosed with distant disease. People with lung cancer are also less likely to be diagnosed with distant stage disease. Less so in prostate cancer. These cancers are what we considered as like the big 4 cancers. They're some of the cancers that have the highest prevalence in our population. We did some back of the envelope calculations here, and what we found was that there's about 2.3 million individuals that the federal agency reports as the worst case housing needs, those that are really cost burdened by their housing or have other needs. And we, again, these are very preliminary, very back of the envelope, found that if you were to kind of multiply out the rate of cancer incidence by these 2.3 million individuals, we think it would be associated with about 400 fewer cases per year of advanced stage cancer, regional or distant stage cancer, and about $15 million in savings. I think the $15 million in savings is relatively low when you think about the cost they're trying to extend the voucher program to all these individuals. but also that this is just one brick in this kind of this edifice, this house that we're trying to build around the health benefits of housing, or the health effects of housing broadly. And so, I think we need to think about this in reference to kind of all of the other things that may improve with providing safe and affordable housing for individuals. So I'm going to now move on to talk about that fourth pillar around neighborhood context. This is a relatively old map, so I wouldn't take the numbers as truth, but it's a map of the Washington, D.C. Region, and it shows the metro line. And what it shows is that downtown in Washington, D.C., the average life expectancy is about 77 years. However, if you take the red line out to Montgomery County, which is a much more affluent part of Maryland, the life expectancy increases to 84 years. And these types of maps, I think, gain popularity because I think they're a very effective kind of communication tool showing that place matters, that where you live can have an impact on your health and well-being. And we wanted to try to explore this more, try to gain kind of greater insight on the ways that neighborhoods and the neighborhood context matters for health and well-being. And so the project I'm going to talk about here is what we call the Mobility Asthma Project, or MAP. And MAP is also an NIH-funded study that I run with Elizabeth Matsui and Corinne Keat, who are two pediatric allergists, as well as, again, an amazing study team, as well as a partner called Baltimore Regional Housing Partnership, which is a local housing organization that I'll talk more about. And again, going back to this idea that place matters, this is a map of the rates of asthma hospitalization for Baltimore City. And it shows, even for people that are not familiar with Baltimore, that there's just tremendous heterogeneity, that there's areas of concentration where the asthma rates are really, really high. And then if you were to look at the next map, which shows Baltimore City again, and what this shows is the racial composition of different areas, and specifically focusing on racially and ethnically concentrated areas of poverty, along with the location of the public housing. So the public housing is, as I talked about, a way that housing assistance has traditionally been provided. And there was a lawsuit that basically said that all of the public housing was located in poor, largely Black neighborhoods. And that was called the Thompson versus HUD lawsuit. And as part of the remedy for that, they said it violated fair housing laws in the United States. And as part of the remedy for that, they created these housing vouchers, these ways to help individuals afford housing, giving them a voucher to lease homes in the private market from individual landlords, as well as a program to help them overcome barriers to using those vouchers in the private market, and said that those needed to be in lower poverty neighborhoods. And so the Baltimore Regional Housing Partnership is the organization that was in charge of enacting that remedy for participants, and they've helped over 5,000 families use their vouchers to move to low poverty neighborhoods. And in talking with them, we heard anecdotally that by being able to move, they saw really dramatic changes in their children's health. And that's something that we, piqued our interest and we wanted to try to document. And so we worked with them to recruit a sample of about 120 or so children. And we did really careful assessments over time before the families moved whenever possible, and then following them initially for up to a year after they moved. Now we're continuing to follow them for even longer. And so I'm going to talk about these kind of initial results showing what happens up to a year after they move. And the first thing is really important to note that the families did move, and they moved to dramatically different neighborhoods. So this is showing kind of where the families lived pre-move, and shows that a lot of the families lived in very high poverty neighborhoods indicated by the darker blue color. They're also all concentrated in the city. This is the map of the city as well as some of the surrounding neighborhoods. And this is a map showing where they moved to post neighborhoods. And you can see here that they moved often to the surrounding counties, and that the median kind of income in the neighborhoods where they moved was much, much higher. The rate of poverty was much lower. And the main finding from this study was that there was a significant reduction in their asthma symptoms. Again, all of these kids had asthma at baseline, and there was a 54% reduction in the odds of an asthma exacerbation associated with moving. Putting this into perspective, this is an effect size that's on par with inhaled corticosteroids, which is one of the traditional treatments that we use to try to improve asthma exacerbations, and similar to that used in some of the more advanced biologic agents. I'm now going to turn to talk, about some of the really careful assessments that we did. And I think we went into this with the idea that a lot of these changes would be due to changes in some of the environmental exposures, specifically mouse and cockroach allergens, which we think of as some of the main drivers of asthma exacerbations in inner city Baltimore. And we did see that mouse and cockroach allergens did decrease significantly for a large part of the families. This last column shows the percent change. Conversely, we saw that some of the other allergens that are associated with asthma, including cat, dog, and dust mite allergens, actually went up in ways that surprised us. But we did formal mediation analyses, and we found that this really wasn't the story that was the most compelling. That mouse and cockroach changes in mouse and cockroach allergens didn't really explain the change that we saw, a change in asthma symptoms that was associated with moving. However, when we turned to stress, things really changed. So we found that as families moved, this is a table showing kind of what happens before and after they move and the change. We found that their sense of neighborhood factors, including their feeling of cohesion in the neighborhood, their sense of safety during the day and at night, really increased quite dramatically. The level of caregiver depression went down just a little bit, and their sense of stress, according to this urban stress scale, went down, and their experiences of discrimination went down quite a bit. I want to pause and just put a pin in this to say that when I present these results, often I hear, but helping families move to non-poor neighborhoods might lead to increased experiences of discrimination. It might lead to them feeling more different and, in relation to their neighbors. And what we found was that, that concern, I understand where that comes from, but, wasn't borne out by our initial data collection. Their levels of child stress also went down. When we did these mediation models trying to understand whether these changes in stress explained a lot of what we were seeing with the asthma exacerbations, we found that these actually made a really large difference, that the levels of safety in particular, as well as this urban stress scale and the like, really explained about up to about a third of the difference between moving and asthma exacerbation. So we think stress matters, and I want to kind of delve a little deeper to think about why stress might matter. And I think we thought of at least 4 different pathways for this. One is that we think that there's the potential for a direct impact on stress on people's inflammatory response, on their actual biology. The second is around health behaviors in terms of like parents smoking in the home and the like. We did some other tests around this with what we were able to measure and didn't see that this was a huge explanatory factor. It also may change the amount of time that kids are able to spend outdoors. You might imagine if you're a caregiver and you think it's not safe for your kid to spend time outdoors, you might keep them indoors, and which can change their exposures that might be associated with asthma. And then also their healthcare access may be changed as a result of their stress. So we think that, that there's some biologic plausibility, there's some kind of conceptual plausibility for the changes that we're seeing. Since we published this paper, we've also started to do work looking at outdoor environmental exposures, finding that those do change quite a bit as families move, and that those are also, have a large explanatory factor. They can really mediate some of the associations. In part, based on that work, we've been working with this community partner, this housing organization, to try to target kids that might really benefit from moving from a health perspective and offer them the services that this organization does to support their moves. And I'm glad to talk about those services. We're still recruiting families into this and trying to study their health effect. But I really like this project in part because the partner organization is absolutely wonderful, and in part because I think it kind of presents this way that healthcare and housing providers can try to work together to target and improve the health benefits of their work. So now that I've gone through these 4 different pillars, I want to kind of suggest that housing is in fact a fundamental cause of health and health disparities. And when we go back, there's an article by Lincoln Phelan talking about kind of like what are the fundamental causes of health, and it needs to meet certain criteria, including influencing multiple disease outcomes. I hope I've shown you that there's a potential that housing can impact asthma and cancer, as well as multiple other ways, that it can affect those outcomes through multiple risk factors, including the kind of in housing, the sense of affordability, stability, quality in neighborhoods. It involves, importantly, access to resources, including money, knowledge, or power that can be used to mitigate risks. And I think we know that the kind of impacts of housing and housing insecurity are not equally borne, and that the association is reproduced over time. So that there's lots of ways that this is something that we saw. We're learning again and again about the ways that housing is linked with health, and in my opinion is a really fundamental cause of the patterns of health that we're seeing. As I was thinking also about kind of the impact of housing, I went back and was thinking about some of the places where I've lived over my lifetime, and would invite you to do the same, to think about kind of the ways that the different places that you've lived have impacted your well-being, your access to care, and so many other factors in our lives. So with that, I'm going to end here. We have a website for the Hopkins Housing and Health Collaborative that we host webinars and the like. I'm glad to have people reach out, and really looking forward to Josep's kind of discussion and thinking about it from an international perspective. So thank you.
Thank you so much, Craig. There was so many really interesting data and really great analysis of so many issues to think about there. So thank you so much for the presentation, and over to Josep. Thanks.
Thank you, Craig, for your presentation. I think that you make really strong points and make clear about the influence of housing and health outcomes. I think the data that you show it's undisputable. Before making some questions, I would like to present some slides about empirical evidence that I have gathered here in Barcelona in order to be more able to create a dialogue between the United States and Spain. I will try to share the screen. Okay. Do you see the screen?
Yeah.
Okay. Yeah, the main things I found, and I think they are pretty interesting and comparable with the United States, is that we find also in here, I present the results of a study that I conducted in Barcelona and its metropolitan region with the European Living Conditions Survey that it's made every year. And I compared the results between 2016 and 2019. And the situation that you described, Craig, I think is quite similar here in Barcelona also, in which we find that affordability issues are the main problem of households, mainly about the tenants. You focus on tenant households here are also the more insecure and the most precarious group in terms of housing circumstances, but also insecurity and quality. We see also that there is an evolution between these 2 years. 2019, it's the last year of the survey, but probably we'll find quite similar results now, is that these problems are increasing over time. We found that the affordability rate increases for 15% to almost above 16%. And also we find a decreasing of quality. Regarding the access of inequalities, the main inequalities related with housing, we find also similar results in relation to what you have presented, especially for we don't have race of or ethnicity as a variable study in this survey, but we have the country of origin, and we see that are migrants one of the most affected groups, but also women. Also, we find a relation regarding age, in which younger households have are more, in which precarious housing conditions are more young households have more precarious housing conditions, and also in relation to income. So I see here like a clear correspondence between the two contexts. And in relation to with relation with health, that it's the main topic of this session, I saw in the data that there is a clear relation between between an affordability, insecurity, and quality, and poor mental health cases. Very brief, I have found that almost between 4% and 7% of all poor mental health outcomes could be explained due to these precarious or poor housing conditions. And this relation, this population attributive fraction increases in market rate tenants between the 10% and the 30%. This is the end of the presentation. I think it's very useful also to present that, to show that the problem, the housing crisis, is not only topic in the United States or maybe Europe or maybe in Spain, that it's a global phenomenon. And I want to ask you, Craig, you have presented about some policies about the effect of housing on health. What do you think? What it lacks in the US housing policy, in order to reflect also in the Barcelona context, what it lacks in the USA housing policy to solve the housing problems of the population?
That's a great question and a really, very hard one. I think that I think a lot of the kind of people that study this in the United States context would say the most important problem is that there's just not enough affordable housing. And so, and we need to build more housing, that there hasn't been enough housing built over the last decades to meet the demands. And so what you see is this, rapidly rising, kind of housing issues that we talked about today, that we see in the United States, and it sounds like you see in Barcelona. And kind of building more housing is, how do you do that in a way that's effective? And I think, many of the people that study this would say that this is, complex. Some of this, and a lot of this, has to do with kind of local and state laws that constrain housing supply due to zoning. And so we've seen some policy action in the United States around zoning reform, trying to, for example, limit the use of single family zoning, which says that, like, if you have a plot of land, that only one home can be built on it, and that there needs to be, some setback or some ways that you're not able to then, build 2 or 3 or 4 units. And I think we're seeing some great policy experiment with that. But I think that also people would say that that's one part of the puzzle, but we need to kind of think about, multiple different parts of the puzzle. And so I think one of the researchers that I like kind of divides this into the 3 S's, thinking about supply, subsidy, and stability. And then we need to think about kind of across those 3 S's, like, what are the different tools and the different policy levers that can be used for that? And supply can be about zoning reform, but it also can be about, tax incentives and other ways of funding the building of affordable housing units, as one example.
Okay, in relation to that, I have 2 questions, because there are some authors that argue that it's very difficult in this context of eco-social crisis to build more houses or to build more buildings. Also, I don't know, I think it's not the context in some cities in the United States, but in Europe, cities are very dense already. So it's very difficult to construct more buildings. Do you think that there is a situation, maybe alternative, to increase the supply of houses, or yes? Is that the question?
I think that this needs to be done in conjunction with other factors. I think, we need to increase the, kind of number of affordable housing. And so, what do you need to do to keep the housing affordable? Like, lots of different ways that you can think about that. But I think that kind of without building more housing, without having more housing available, it's hard for me to see how this problem gets solved with just rearranging amongst the pieces that we have. And I recognize that, in many places, cities are already dense, but I do think we need to think about ways to increase the density. Or other people would argue that, some of the zoning restrictions, you need to have every unit requires to have its own kitchen or its own, different things. And maybe we should think about ways of having micro units or having kind of more of we moved away from like single room occupancy, but maybe by having a wider choice of different types of housing structures and units, that may help meet needs. So I think there needs to be some creativity applied, but also some real urgency.
In following this conversation, because here we have during the 2000 decade a Spanish housing bubble in which the construction of dwellings increased dramatically, but the housing prices also increased dramatically. So in Barcelona, there are a lot of people that argues that constructing more buildings does not necessarily reduce the housing prices. What should be the role of the state here in order to avoid this situation?
Yeah, so in the United States, there was also, an enormous housing bubble that left a lot of people, facing foreclosures, which we know that foreclosure and some of the work that we and others have done shows the tremendous impact that foreclosures have kind of on a health level as well as, broader societal level. And I think that people don't want to go back to that side where there was kind of lending that was done in a way that was often quite predatory, really targeting on people that were most vulnerable in our society. So I think that there needs to be, and there have been, at least in the United States, reforms about the way that lending has been done for that. So I think nobody wants to go back to a housing bubble and increasing prices. So I think, again, this needs to be done thoughtfully. And I think there are specific lessons, most directly that I've heard kind of most loudly around kind of lending standards and, the avoidance of predatory lending that we need to really heed.
Okay, changing a little bit the subject, I was very interested hearing your presentation and also hearing other presentation of yours about the mobility programs, the programs that from the University of Baltimore the Hopkins have designed. But I was asking myself, what are the limitations of these mobility programs, also in social and also in political terms? Because you responded in advance about this discrimination and social cohesion critiques of these programs, but maybe there are not some kind of survival bias in which households that indeed are able to relocate are the one that have a success, and there is some bias in the results. I don't know. There are some kind of what are the general limitations of mobility programs? Also, there are methodological ones. What do you consider?
Yeah, so maybe I'm going to take this in a number of different ways. So I think one with our specific study in Baltimore, Maryland, we did a lot to try to limit bias, recognizing that there's still the potential for bias. So this was an observational study where we followed families and recognized that families that move might be different than families that don't move, that as you observe, people often, they get better by dint of being observed. And so we try to be as careful as possible with that, doing a lot of different comparison groups and the like. This is also a place, and there's a comment in the chat that brings this up, where there's actually really great randomized controlled data from what's called the Moving to Opportunity experiment. Moving to Opportunity was an experiment, and it's kind of a fascinating story, so or at least I think so I'm going to go into it for a moment. So Moving to Opportunity was started in the mid-90s by the federal agency that oversees this type of work. And it came about because, in part, based on these fair housing lawsuits, they saw some really positive results of helping families move, and they thought that it would lead to economic benefits for the families. And of course, if you could have economic benefits for the families, they're able to get better jobs, higher paying jobs, that then it could lead to less government expenditures on this type of housing support, or you could use the government expenditures to help more families. And so they ran this randomized control experiment in 5 different cities across the United States, and basically flipping a coin to for people living in public housing, they were either randomized to a control group that didn't get kind of a new voucher, or they were randomized to one, get a voucher that they could kind of use without restrictions, or two, get a voucher that needed to be used in what they considered an opportunity area, which was defined as having low poverty and other factors. And what they found initially was that, first of all, it was hard to help families move. There wasn't the same supports that the program that we use in Baltimore, or we work with in Baltimore, currently has available. So a lot of families weren't able to use their voucher to relocate to opportunity neighborhoods, and those that did move didn't always stay in that neighborhood for a long time. And initially, some of the economic outcomes were a bit of a bust, that they didn't help families kind of increase their economic success in the way that I think the people that kind of started the experiment thought it would. However, through talking with families, they found that actually there was some really significant health effects of this, and they started to explore that, including long-term outcomes, finding that in the long-term follow-up that happened about 12 years after randomization, that there were significantly lower rates of diabetes and obesity, extreme obesity, among individuals that got the chance to move to opportunity neighborhoods. So this is a place where we have really good evidence, and I think the evidence is continuing to grow about the health impact. But I also want to bring up this strand that the individual from Disability Rights Maryland brings up, which is that, like, first of all, don't we know about the health benefits? Like, why are we still studying this? And I would say that we know about some of the health benefits, but I think we don't always understand the mechanisms. We don't always understand the different health benefits, right? Like, moving to opportunity didn't see a big impact on self-reported asthma, whereas we're seeing that. And I think the implications are really important for example, how we think about home remediation, that if we're just focusing on the environmental exposures without thinking about the kind of stress in the home or some of these other factors, that we may be missing some important pieces. But I think the other point that's raised is also really, really important, which is that idea of, like, by helping families move, are you forgetting about the families that don't want to move, shouldn't have to move, can't move, all of those things? Like, how do we think about kind of investing in places? And I want to really avoid the kind of the binary thinking that we're helping families move or we're investing in places. I think that zero-sum thinking is kind of the wrong framing for this, that I think we need to offer people opportunities when these opportunities have been constrained by a variety of factors, right? Like, there's a reason why individuals move to different places, or lots of reasons why people move to different places. And often those choices are constrained by who's willing to accept the voucher, what the payment standards are, whether there's a security deposit, so many different factors. And we also need to work to invest in places so that people shouldn't need to move in order to realize opportunity, recognizing that families are going to make different choices when they're kind of given the supports that they need in order to recognize that. Happy to have more of a discussion on it. I always think it's an interesting kind of interesting points that people have really different viewpoints on, and I really welcome conversation.
Yeah, I would like to continue with this topic because I think it's very interesting, like this idea of mobility programs as a policy proposal. But following the comment that has been done in the chat is how to make this solution universal to the people that are also living within these deprived neighborhoods, because normally our population that doesn't have the possibility to buy or to rent in another areas, even if there are like housing prices decreases. And also I wanted to ask you about if you have studied, because I think maybe it's interesting, about the consequences of these mobility programs in the neighborhoods of origin, because maybe there are some kind of residential mobility and a loss of social cohesion about people leaving this neighborhood. I don't know if you have checked that in your research.
Yeah, so the specific question of, like, what happens to the neighborhoods after families move out, that's not something we've studied, and I think, it's certainly possible to be a concern, but I think the number of families that are impacted by these mobility programs as of right now is not at a place where, I think it's going to lead to a real substantial change in, population. I'd be, if people have data on kind of like the number of people in neighborhoods that are being impacted by this, I'd be absolutely curious to see, and would love to kind of brainstorm about how we could try to document that. In terms of the other question of, like, maybe I'll say that I think there is a move to try to kind of explore and test these types of mobility programs. And there's something called the community choice demonstration, which is a large randomized control trial. So I forgot to, I left out some of the punchline for the Moving to Opportunity. So Moving to Opportunity was, considered initially a bust from an economic perspective, that families given the chance to move didn't earn more. But then an economist at Harvard named Raj Chetty linked MTO families, Moving to Opportunity families, with their tax records and was able to follow up what happened to the kids whose families were given the chance to move, and found that as those kids became young adults, that they had higher earnings. And that idea that kids given the chance to move at a young age had higher earnings got a lot of attention and traction in the policy space. And so Congress put money aside. And I should say the other thing about that is, again, I mentioned that Moving to Opportunity didn't do a great job of helping families move and supporting them once they were there. Raj Chetty and others did a trial in Seattle in Western United States, where showing that they were able to, using kind of best practices like the practices of the organization we partnered with in Baltimore, they were able to help a larger portion of families that were interested in moving actually move to low poverty neighborhoods. And so kind of based on those two pieces of information, one, that there's long-term economic benefits for children, and two, that there's kind of data to suggest that they can actually help families effectively move. There's a large-scale demonstration project that's currently being done in the United States called the Community Choice Demonstration. And as part of that, they're doing a randomized trial to help families who have a housing voucher see whether or not they are offered services and able to move to different neighborhoods using those vouchers. Because again, like I would say that the program is called the Housing Choice Vouchers in the United States, and part of that, kind of implicit in this program is this idea of choice. And so I think it's, I think many people that kind of started this program would say it's about trying to put choice back into the equation here. You also had a question around kind of like, how do we support neighborhoods? And I would say that, a lot of the ways that we've, worked to support neighborhoods in the past have been really difficult and haven't always panned out. And I think, what is increasingly being tested is these multimodal approaches, that it's not just about kind of weatherizing homes in neighborhoods. It's not just about kind of, demolishing vacant and abandoned buildings, but it also needs to be done in other ways, thinking about economic support for the families, thinking about ways to try to reduce crime, really in these kind of multifaceted interventions that require a tremendous amount of money, require a tremendous kind of and sustained investment with community members to make sure that it's done in conjunction with the communities that are purported to be served, rather than foisted on them.
Yes, but I was worried about from a social justice perspective, about the universal pretension of the mobility programs, because it's very difficult to yeah, because it has like an exclusion criteria that only a few people or only a portion of the people can move to better neighborhoods. If not, we are changing the people and we are locating them in other places. I don't know if there are a universalistic alternative.
So, I mean, I think I worry about the logic of that, of like, first of all, like only a few people can move. I think that actually with appropriate supports, that like a lot more people than we currently have could be able to recognize kind of their preferences and move to different neighborhoods if that's what they want to do. And I would say with the Baltimore Regional Housing Partnership, our partner organization, that there's a tremendous number of people on the wait list to receive a housing voucher, in part because they want the financial benefits of receiving the housing voucher, but also the services that are provided. So I think it's really important. There was also a question in the chat that I just want to raise up around the role of gentrification, and I think the role of gentrification is incredibly important. It's often kind of an area that can be, tricky to study because, on the one hand, as we were talking about, like there needs to be sustained investment in neighborhoods that have been systematically disinvested in for a very, very long period of time. But the risk of that type of sustained investment in neighborhoods is the potential for gentrification, where people who had been historically living in the neighborhoods can no longer afford to live in those neighborhoods. And so I think, again, as we think about kind of like broad solutions for the kind of the problem of unaffordable, unstable, and secure housing that we need to think about as we're investing in neighborhoods. What are the ways that we can kind of work with communities to make sure that those communities are being listened to and being, like that they're, being honored in the process. And I think that you see some different solutions, some around community land trusts and the like. There's another question that came up just around the impacts of gentrification on health. I have not particularly looked at gentrification in my own research. I'm aware of others that have looked at gentrification. One of the things that's tricky about studying gentrification is that, as the ways that some people do research, if they're kind of like looking at a neighborhood over time, that the kind of the health profile of the neighborhood may change as a result of people with higher socioeconomic status, more college educated, and the like moving into it. But that's, kind of a change in the overall population level impact, but there's many people that move out in neighborhoods that are rapidly gentrifying, and you need to kind of try to kind of follow those individuals as well to understand the total impact. So I think, as we look at studies of gentrification, we need to make sure that they're kind of accounting for this kind of flow and churn of individuals to make sure that the kind of the total health effect both and really the potential negative effects are appropriately examined. Maybe while you're thinking of a question, there was one other question that I want to raise up around the mortgage interest tax deduction. And so just to say that the mortgage interest tax deduction is when people buy a home in the United States, they're often buying a home with a mortgage, that they're getting money from the bank in order to pay for the home at a certain interest rate. And the US government says that, up to a certain level, that, you don't need to pay taxes on some of the money that you're paying back the bank in terms of its interest. I may have said that I'm thinking about taxes as it's tax season in the United States, but I may not have said that in the clearest way. So, welcome to people to clarify. But basically, it's ends up being a large financial benefit for people that have a home and have a mortgage with their home, because they're able to kind of buy more home or spend less money on their home than they otherwise would. And I think I have not seen studies that have looked at specifically at the mortgage interest tax deduction on health, but I would say that there are studies that look at kind of what are the health differences between homeowners and renters, showing that there are some significant differences in the health effects of like living in a home that you own versus one that you rent. A lot of those are confounded by the idea that richer individuals are those that tend to buy homes, those that have more access to kind of power and resources. So kind of it can be hard to disentangle. Is it really about home ownership versus the kind of the underlying conditions that enable you to own a home? And I think from a policy perspective, we spend a ton of money, tens of billions of dollars each year in the United States on this mortgage interest tax deduction. But it's often kind of hidden. It's often like a policy that supports homeowners in ways that when you're thinking about kind of the move to expand affordable housing, and people are thinking about ways to cut government spending at this and other times, that it's often easier to say, okay, well, the programs that go to the federal agency that support housing are potentially a more visible target than some of the mortgage interest tax deduction, which tends to favor and go towards higher income individuals. And again, is just a lot of money in comparison to the, what I would say is the too little that we spend on supporting individuals afford their housing.
I have a question because you were talking about the symmetrical relationship between landlords and tenants in the right to counsel aspect. Did you see that this specific aspect also play a role in the relationship between housing and health, apart from the legal representation?
So that study in particular was really focused on the legal representation. I think the kind of more generally the kind of like relationship between landlords and tenants is really important. And I think that there's, a lot of, sociological research on kind of landlords in the housing landscape. And I would say that some of it, initially our view has been like one of like oppositional. And I think that there's, lots, and I think a lot more of the research is kind of taking seriously the idea of like, a lot of what they consider as the mom and pop landlords that have like, smaller portfolios of properties are often stretched thin in different ways and need to think about ways to support them, make it easier for them to rent to voucher holders and the like, but also recognizing that there's, a role of private equity on the other hand, and people that are buying a lot of properties. And so that this relationship is complicated. It's going to vary by the type of landlord, but vary across place in ways that, I think requires, just careful consideration.
Okay, I don't know if there are more questions on the audience.
I have a question, if there's no other ones ahead. Yeah, thanks. I just wanted to ask either of you, I guess Craig or Josep, if you have any examples of maybe countries or cities where kind of health outcomes in terms of health equity and housing are really positive, kind of any like good practice, places of reference where even kind of more working class communities have like better health outcomes linked to better housing conditions, and maybe what kind of policies have led to these positive outcomes I guess I'm thinking more about equity for the whole society, or for the whole neighborhood at least. I don't know if either of you have any thoughts or references for that.
I'm hoping Josep is going to answer, but I don't have an international, reference for that. I think there's, a lot of discussion about social housing in Europe and how that plays out in ways that, I think has some parallels with the housing assistance in the United States and also some important differences. There's, a move in the United States to have some more community land trusts. And the idea is, I think been used in other countries to suggest that maybe we need to have kind of more collective ownership of properties where people can then kind of buy or rent into that with limits on the amount of money that they can make if they move or sell their place. And that kind of collective living arrangement, I think, is really important. And there's a lot of different ways that might impact health. But Abe, also, I think in your question, I think there's a lot of variation across the United States, and in variation in ways that I think is really interesting, because I think, there's, a lot of the East and West Coast cities that are more typically associated with liberal politics are often those that are, really right now grappling with incredibly high housing costs. And some of the other places, like there have been some examples of places in Texas that have tried to tackle this well, and some of that through kind of building more houses, trying to make the housing more affordable, trying to lower kind of some of the zoning friction involved with building that I would, I think people are looking to as a potential example.
Okay, I can also, here in Barcelona, it has been a few examples of experiments with cooperative housing here in Barcelona, through community land trusts also, or similar legal experiments. The problem is that one of the problems is that in Barcelona, the spaces where you can urbanize are very limited because it's a very dense city with high-rise buildings. So it's very difficult to. We don't have here, at least in the city of Barcelona, a problem of single room, single household buildings. And the problem is that if they are not made massive and with a lot of subsidies from part of the public administration, normally the cooperative housing is somewhat limited to middle class or high class households that are able to make the front payment in order to cost the cooperative. So poor working class households are more or less excluded from that. But it's a good solution, but it needs a cooperation from the public administration in order to enhance that. It's an universe that the accessibility to these cooperatives are universal. This is my comment about that. I don't know if there is more comments in the audience. I have one, Craig, also. So in order to read jointly the results that we have made, what do you think are more or less the commonalities in respect to these poor housing conditions between the US and Barcelona? And do you think that there is a global trend?
Yeah, so I do think that what I've heard in other countries is that there is, a global trend. I lived in Berlin for a year, a couple of years ago, and in Berlin, there was also a lot of discussion about kind of high and increasing housing costs in ways that made it unaffordable for, people to live, to be able to afford the other needs, and kind of increasing public unrest around that, kind of focusing on this of like, what is the policy solution, recognizing that it probably again needs to be multifactorial in its approach. So I do think that kind of what we're seeing in the United States, unfortunately, is a problem that, as I understand it, is increasing, in many countries around the world. So and I think some of the solutions that we've talked about, maybe ones that are shared, again, thinking for me, those three S's of supply, subsidy, and stability, and thinking about the policies and the range of policy solutions that might support each of those, kind of the goals might be similar, but the ways that they are kind of play out in the local context will, of course, need to vary quite a bit.
Thank you. I'm not sure if there's any other questions. Please go ahead to and write them in the chat or in the question and answer box. I'll give Ron just a couple of minutes in case there's any last minute questions. But yeah, thank you so much. It's been really interesting. Also interesting for us. I feel like there's although there's overlap in terms of the problems, there's such difference between the US and Europe in terms of kind of solutions. So it's really interesting to have these cross-cultural and cross-Atlantic conversations to learn a bit more about how the issue is being dealt with in different contexts. So I think, okay, yeah, I'm not seeing any more questions. So thank you so much, Craig, and thank you so much for talking for so long as well. I know it's been a long session and a lot of questions to answer, but it's been really great hearing about your research and hearing your perspective on these issues. And thank you as well to Josep for moderating and for your questions and your perspectives and inputs as well. Yeah, I'll just share actually down here. Here's the link in case anyone wanted to see our YouTube channel with the other videos. And thanks to everyone for taking part. Oh, I should have my video on. Yeah, thanks to everyone for taking part. And yeah, have a great rest of your evening.
Thank you all. Take care. Appreciate the discussion.
Thanks.